So maybe you're a few months away from turning 65. You're new to Medicare, or perhaps you've been on Medicare for 6 or 7 years. Regardless, one thing I know is this: when you turn the TV on from October to now, you're going to see a Medicare commercial. You're going to see an ex NFL player like Joe Namath talk about zero premium plans with free dental, free vision, free pet companions, free groceries, you name it. So, why do insurance companies, private insurance companies, spend billions of dollars to try to get you off of original Medicare and put you on a Medicare Advantage plan? Okay, so today we're going to talk about the pros and cons of Medicare Advantage plans, as well as the pros and cons of Medicare supplements, otherwise known as Medigap plans. And we're going to help you decide which one of those options is best for you. Over Medicare, we're an independent independent Medicare brokerage company licensed with 35 different carriers in 32 different states. Okay, I've been a Medicare advocate for well over a decade. And unlike some agencies that charge a fee, our services cost you nothing. Although we've transitioned into an online Medicare brokerage company, we also make house calls. If you live in Hilton Head or Bluffton, you can stop by our office at 222 Goethe Road by appointment only, or we can do a screen share and do it all online over your computer or your cell phone. Regardless, we are your one-stop shop for Medicare supplements, Part D standalone drug plans, Medicare Advantage plans, and we're going to serve you for the entirety of your Medicare. Now, I'm the guy that's going to cover the differences of Advantage plans and Medicare supplements. Make sure you understand these vast differences in both plans, as I'm also going to tell you my own personal opinion on which path you should go to. You know, because if you ask 98% of agents that do what I do, if you ask them, hey, who do you got your mom or dad on? Which plan do you have them on? 98% of these people are going to tell you the same exact answer. By the time you finish this video, you're going to know the simple facts about Advantage plans versus Medigap plans. And like the late, great Paul Harvey said, only now you'll know the rest of the story. And you will know the rest of the story. So let's go forward. The first thing we're going to talk about is Medicare Advantage plans. All right. So with Medicare Advantage plans, what happens is you opt out of original Medicare. Basically, what you paid your FICA taxes your whole life to get original Medicare Part A and B. What you've decided to do with Medicare Advantage plan, you're going to give up Part A and Part B, and you're going to privately run insurance company is going to manage your care. It's a managed care. Now, Medicare Advantage plans must offer all the same benefits, the minimum benefits the original Medicare does, the minimum amount. But unlike original Medicare, you're going to have restrictions. Or option number two is they can go on a Medigap plan or a Medicare supplement plan. Medigap and Medicare supplement are the same thing. Don't know why they have two separate names for them, but Medigap, Medicare supplement, same thing. And so you keep your original Medicare Part A and B, and you can go anywhere in the United States you want with your original Medicare A and B, and the Medicare supplement follows it. So no matter where you go, you've got original Medicare, and you got the Medicare supplement that pays what Medicare does not pay. There's one other option I didn't talk about. You could just have original Medicare Part A and B and nothing else. So with original Medicare Part A and Part B and nothing else, if you know for a fact that you're going to be healthy and not have any issues, that's a great option. But let's face it, nobody takes that option. So most folks aren't going to just have the original Medicare. They're either going to go with choice one, which is a Medicare Advantage plan, or choice two, which is original Medicare with a Medigap or Medicare supplement plan. Another thing too, you cannot have a Medicare Advantage plan and a Medigap or Medicare supplement plan. The two don't work together. So if you have an Advantage plan, that kicks out your original Medicare. You opt into the private insurance managed care, and that doesn't work with the supplement. So you can have a Medicare Advantage plan, or you can have original Medicare along with a Medigap Medicare supplement plan, but you can't have both. So what is original Medicare? Let's take a look. So your Part A is your hospital. Your Part B are your doctor services, your outpatient services. So what you can do, you can get a Medigap supplement to pay what original Medicare Part A and Part B does not pay. However that Medicare goes, if you move or you travel, you take that Medicare supplement with you, and it pays your Part A deductible, so you have no Part A Your Part B, it pays almost all of your Part B costs with there's a small deductible. We're going to talk about that in a minute. So let's talk about those Medicare Advantage plans that ex-football players and celebrities and the mail that you got bombarded with that tells you about free dental, free vision. Let's talk about that for a second. Number one, you have to opt out of original Medicare Part A and Part B. And you also have to check to make sure, you have to see which plans are in your area. There are different Medicare Advantage plans based on your zip code and where you live. So what you have to do is you got to go to, I would suggest going to medicare.gov or call us and look for plans in your area. Now, most of these plans are going to be HMOs. You're going to have PPOs as well with an HMO. You have got to, your primary care provider must be in network, or that you can't do the HMO. You have, unless you want to change doctors. If you go outside the network, you're responsible 100%. With HMOs, you do have to have a referral. So you'll have to, if you want to go to see a specialist, you'll need a referral from your primary care. Very restrictive networks, typically local HMOs. With PPOs, you can go outside the network. The provider doesn't necessarily have to take your insurance. Like, you can't go to the Mayo Clinic, you can't go to MD Anderson. It's based on whether they're going to agree to the terms and conditions of the insurance carrier. With these Medicare Advantage plans, there's one exception where you can go outside of your network and you'll be able to get covered, and that's in an emergency. Medicare supplement, you can travel anywhere in the United States or overseas, and you got 100% coverage. It goes wherever Medicare does, your Medicare supplement. So just keep those in mind. There are costs, there's co-pays, there's maximum out of pocket. You're going to have to pay the $170 a month Part B premium. The Advantage plan doesn't pay that. They do have, some of these Advantage plans have givebacks. There's a great Advantage plan for veterans that gives veterans $100 back every month. So they're only paying $70 in their Part B premium. But other than that, you have major costs if you get sick. All right, so what do Medicare Advantage plans cover? The first thing you got to realize about Advantage plans, by law, once you opt out of Medicare and relinquish your original Medicare rights to a private insurance company, that private insurance company must cover the minimum, the bare bones minimum of what original Medicare Part A and Part B cover. However, this is a little tricky here. I don't want you to think that Medicare Advantage plans, when your doctor says you need knee replacement surgery, that the private insurance company is necessarily going to give you the okay on that. Let me give you an example. Had a lady about 2 months ago. Same situation. She needed total knee replacement surgery. She couldn't even walk. She had a cane, and she had United Healthcare, and her doctor said, yeah, let's get you in. Let's get this knee surgery done. Well, I get a call. She's in tears. The insurance company denied her. She's on disability, and don't mean to go off on a tangent here, but if you have disability and you're under 65, Medicare Advantage is the best way to go, because it's the only way to go. That's all you can get when you're on disability and under 65. They have Medicare supplements in the state of Georgia, but for anybody under 65, it's right around $900 a month for the premium. So let's just throw that out there. So they must pay the minimum of what Part A covers, but they deny. There was a study by the Kaiser Foundation back in 2016, countless millions of denials. The interesting thing was, when people took the initiative or called their agent, because I do this for all my clients, we do the appeals. 75% of the time, these private insurance plans will cover it once you appeal it. So what that tells me is these private insurance companies are routinely denying. They're hoping you go away, that you'll just say the heck with it, because that's their first line of defense, is denying. And the video, after this video, you click on the next video, and you're going to be awestruck when you watch the video on the millions of denials for routine medical procedures that these Advantage plans, over 50% of them are in trouble with CMS, Medicare right now, for exactly those types of violations. So, other thing is, you're like, zero premium, no cost. Yes, they have costs. More importantly, you still got to pay your Part B premium. I had a gentleman who I've been working with him for the last week, trying to get him off the Advantage plan. He's still healthy. so he could go to a Medicare supplement. He says, Chris, why would I go to a supplement? I don't even have any costs. I don't have a Part B premium. And he goes, I have no premium for my Advantage plan. Well, his Advantage plan, actually, it was a $30 a month premium. It wasn't a zero premium. I said, that's automatically taken out of your Social Security Medicare check that you get every month. So he checked his Social Security. He's like, wow, I didn't even realize that. They automatically take that out of my check. He didn't know it. So if you don't think you're getting the 170 taken out, all you got to do is look at your Social Security check, call Medicare, they'll tell you. And he was also, most agents, if there's a premium for a Medicare Advantage plan, they're going to click automatic out of Social Security so you don't even see it coming. They just take that premium right out. And they take the 170 out. So you still have to pay the Part B premium. The zero premium plan has costs in the form of copays. There are copays for hospital. On average, it's about $350 a day for days 1 through 5. Keep in mind, a 5-day hospital stay with a Medicare Advantage plan pays your entire Medicare supplement premium for the whole year. You're in the hospital 5 days with an Advantage plan. That the entire year's premium in Medicare supplement could have been paid, and you would have never had a hospital copay. There's $50 copays for specialists, $40 for some of them, $50. Sometimes they have a zero doctor's visit, but they nickel and dime you $40 every time you go to physical rehab. You've got 20% for all cancer treatments. Let me say that again. If you get cancer, you're in a restricted network, and you're going to pay 20%. The Advantage plan, just like Medicare, is going to pay 80%. You're going to pay 20%. These Medicare Advantage plans do have maximum out-of-pockets. That's your worst-case scenario. Most of those, the Medicare set the standard for $7,500. So once you spend $7,500 of your own money, yay, you don't have to pay anything for the rest of the year until January comes around. When January 1st comes around, you got another $7,500 maximum out of pocket. If you have cancer or anything serious, you're going to hit that $7,500 within a couple months. All right. So, and one last thing about Advantage plans. When you watch the commercials, whoa, yay, drug coverage is included. It's bundled into your Medicare Advantage plan. You know, and on the surface, that sounds great. Wow, I don't even have to pay for a standalone drug plan. It's included in my Advantage plan. Here's the thing. I mean, in Beaufort County alone, there's over 30 prescription drug plans. Lots of different ones that you can choose from. But with an Advantage plan, it's built in. You don't get to choose which drug plan you're on. It's a plain vanilla drug plan that they choose, not you. So they're choosing the drug plan for you. Every drug plan has a different formulary. And when I mean different, I mean different. Like if you look at WellCare's drug formulary, and even within WellCare, there's 7 different plans. There's a few plans that hardly cover anything, and then other plans that cover a lot. So you're stuck with a plain vanilla drug plan that the insurance company chooses for you. So the first thing you want to do is you want to type in your drugs. You want to go to Medicare.gov. You want to go to Plan Finder. Or better off, just call me. I've got the best software in the world to pinpoint tiers 1, 2, 3, 4, 5, which drugs are covered, which aren't, which might need a pre-authorization. We've got the software to do this for you. So before you pick an Advantage plan, you want to type those drugs into Medicare.gov, and then Advantage plans will pop up, and you can look to the penny how much you're going to cost. And you can go total costs, premium plus drug costs, and it'll list from least expensive to most expensive which drug plan that's built into the Advantage plan is going to be advantageous to you. So you want to do that. But I got to tell you, to me, that's a disadvantage. I've got clients, some of them with lists of drugs of 25, 30 prescriptions. Those are mostly my disabled clients. And I take the time and I am very precise and in depth when I look up their drugs, because I have to be. It's going to cost them a fortune if I make even a little mistake. So, you know what? Just call us, 843-227-6725. Let us do the heavy lifting for you so you can go out and go golfing or spend time with your grandkids. But again, it's not advantageous to have a built-in drug plan, because you know what? What happens if 2 of the 3 drugs that you're on are not on the list? Guess what? If they're not on the formulary, you're going to pay the full cost of the drug unless you're able to get a pre-authorization from your doctor saying you have to have it, and it's still going to be expensive. All right? Okay, guys, and the last thing about Advantage plans is every single year, the Advantage plan, let's say you have with Humana, the Advantage plan, the PPO zero premium plan that you have with Humana, and you'll love it. The doctors are in network, your drugs are in the formulary, it's working for you. What you got to remember is this: when October comes around, be ready for the annual notice of change. It's a letter that they send you that they're required by law to send you that has to go over all the changes in the plan. They're going to go over the drug formulary changes. Hey, gabapentin was a tier 2 preferred generic drug. Ooh, this year it's a tier 3, so it's going to cost you $47 a month. Or perhaps your specialist over in Coastal Medical is no longer accepting Humana. That's not in the annual notice of change. So what you want to do is you want to go to the plan's website. Let's say Humana. You want to look at doctors in next year's network, not this year's. Next year's network. You want to, heck, I'd call your doctor and just double check and make sure that he still takes the plan, because he decides not to cover one of your drugs or puts restrictions on it. You need to call me or call your agent and let them help you with this kind of stuff. It can get complex, and Advantage plans are all the bells and whistles and the moving parts are constantly changing. Unlike Medicare supplements, big thing is this: if you travel, I have so many people in Hilton Head and Bluffton that go up north during the summer, or they travel, or they go overseas, or they go back to Ohio. Got a lot of those. Point is, if you travel or you go up north, like my dad lives in St. Simons in the most of the year, and then he goes up to the Adirondacks at our lake house in the summertime, so he can go to the Saratoga racetrack and lose money or win money. I don't know. Point is, Advantage plans aren't going to work for you. The only time you can use an Advantage plan outside your little area is if you have an emergency. We already went over that. So at this point, you're probably saying, I think this guy likes Medigap or Medicare supplement better than Advantage plans. And you'd be right. Reality is, I've got hundreds of disabled clients on Medicare Advantage plans, and I fight for them day in and day out with appeals, with getting things covered, with helping them navigate doctor networks. A lot of things most agents don't. So listen, I understand budgets. Like I said, half my book of business is disabled people making less than $1,700 a month. So if your budget doesn't allow you, I'll help you pick the right Advantage plan, and you got 24/7 concierge service from me. I'm your customer service. Don't call Humana. Don't call United Healthcare. Call me or Roxy, and we'll help you with appeals, with pre-authorizations, pre-certifications, all the problems that Advantage plans have. We'll help you solve those. And again, because we're an independent brokerage, an independent agency, licensed with all the different Medicare Advantage plans, most all of them. There's a couple I won't get licensed with. We're licensed with over 30 different Medicare supplement companies. You can pick and choose the plan that's going to fit your particular needs, your drugs, your doctors, all right? But if you can afford it, oh my God, Medicare supplement with original Medicare is the best thing in town. Basically, you can go anywhere in the United States. If you go back to Ohio or you go up to New Jersey, you bring that Medicare supplement with you. You can literally, if you want to go to ND Anderson in Texas next week, you can go there and the supplement pays all or most all of everything that Medicare does not pay. You have the freedom. You get to make the choices on your healthcare, not the insurance company. So let's talk about Medicare supplements. Okay, guys. So just to reiterate, a Medicare supplement is the same thing. They're the same thing as a Medigap policy. The government typically goes by Medigap. And the reason why they named Medicare supplements Medigap is because there are gaps or expenses that you got to pay when you're just on Medicare. Medicare Part A, you've got a gap that's a hospital deductible that's around $1,500. And Medicare Part B, there are a bunch of different holes or gaps that a Medigap or Medicare supplement is going to pay those gaps. So there are a variety of different Medicare supplemental plans or Medigap plans. There's 10 actually, and they are identified by letter. So a Medicare Supplement Plan F, or a Medicare Supplement Plan J, or a Medicare Supplement Plan N from other Medicare plans. Now remember, I just told you guys there are Part A, Part B, Part D. Those are parts. I don't want to just put those parts off to the side. Part A is your hospital. Part B are your doctor and outpatient services. Part D stands for your drug plan, that's your drugs. Part C is if you go with the Medicare Advantage plan. So let's just shove those off to the side and talk about Medicare supplemental plans that also have letters. We're going to look at, there's a multitude of different Medigap or Medicare supplements that you can choose from. Right here you can see the chart. Right here you can see the Medigap or Medicare supplement plan comparison. Out of these 10 lettered plans, we're going to look at the best three. We're going to look at the Plan F, the Plan G, and the Plan N. So what I'm also going to do for you is I'm going to tell you which one of these three top plans I like the best, which one I like the least. You got to remember is when choosing a Medigap or a Medicare supplement plan, the number one factor is rate stability. And there's a science to finding the company, the Medicare supplement plan letter, and the company that's going to offer you the most rate stability. And that's what my job is your agent is to do. All right. So the first plan that we're going to look at, and it was by far the most popular plan up until January 1st of 2020, and I'm going to talk about that in a minute, but the Plan F. The Plan F is the most comprehensive plan. In fact, if you got your original Medicare card and you have a Plan F Medicare supplement, you actually never have a bill. Besides your drug costs, you go to the hospital and have surgery, no bill. You get outpatient surgery, specialist, doctor's visits. The Plan F, as you can see right here, pays everything. Pays your Part A and Part B deductibles, pays your coinsurance and hospital costs, your coinsurance and co-payments for Part B. Basically, if you have a Plan F, you leave your checkbook at home. So today, would I put anybody in the Medicare Supplement Plan F? No way. I haven't put anybody in a Plan F since about 2017, and that was too late. I'm going to tell you why. So, on January 1st of 2020, Medicare said, you know what? No more Plan F. If you were 65 after January 1st of 2020, they said you can keep your Plan F, or you can even enroll and switch to a different company's Plan F. Realize that with these supplements are standardized by Medicare. What does that mean? Just think, standardize the same. The Medicare Supplement Plan F that covers everything Medicare doesn't. Humana's Plan F offers the identical benefits and coverage as a United Healthcare Plan F. The only difference between United Healthcare's Plan F and Humana's Plan F is the monthly premium. All right, that's it. Otherwise, they're identical. So in 2020, they stopped offering the Plan F to people turning 65. So anybody turning 65, today, you cannot get the Plan F. Anybody that was under 65 on January 1st of 2020, you can't get the Plan F, all right? And there's two reasons why I don't like the Plan F. Even if you have a Plan F right now, I would get off it as quickly as possible for two reasons. Number one, the Plan F has an older, sicker pool of people, and your insurance premiums and your rate increases are based on the number of claims in a year that people in that pool of people in your Plan F, how many claims is going to determine how much they need to raise their rates. So with the Plan F, you have an older, sicker pool of people that really went in the Plan F because it's got the most comprehensive coverage, and they're usually the sickest ones. So this sicker people gravitated towards the Plan F because they had some issues when they turned 65, so they went into that. So that's why number one. That's the first reason why I don't like the Plan F. Think about it. Healthy, new to Medicare folks, the youngest of the young, they're not allowed in the Plan F anymore. So the only people that are in the Plan F are the ones that are stuck in it. that wanted that comprehensive coverage because they probably had some issues. All right, so that's the Plan F. We don't want it. Number two, the second reason why I cannot stand the Plan F is because before January 1st of 2020, the Plan F, that was the plan that took all your sick people. The Plan F was the plan that took all your sick people. What do I mean by that? So there are certain situations or certain Medicare protections people have where they can get a Medicare supplement even if they're on their deathbed. All right, they're called guaranteed issue right situations. All right, let me give you a few examples. Let's say you turn 65 and you decide to go with a Medicare Advantage plan. 3 months later, you find out you got cancer. Well, you have what's called your Medicare trial right. You have 12 months from the time you turn 65. If you go in a Medicare Advantage plan, you have 12 months to go back into original Medicare and get a Medicare supplement with no underwriting, no health questions at all. And before January 1st of 2020, all these sick people that use their trial right, or let's say you lost your group or retiree coverage. AT&T in Texas, I think they downsized. Like, I'll give you an example of losing your group or your retiree coverage. A lot of folks at AT&T, hundreds of thousands of them that were retired on Medicare, they had great AT&T retiree coverage that worked really well with their Medicare. Well, AT&T pulled the carpet underneath them and they lost that. So all those people have what's called a guaranteed right issue. They can get a Medicare supplement no matter how sick they are. They can get a Medicare supplement with no health questions asked. That's another example. Another example, quite often we run into folks that are on a Medicare Advantage plan, and guess what? That Medicare Advantage plan company decides we are not going to offer that plan next year in your area. Happens every year. When that happens, you get all these Medicare Advantage people, some of them who are really sick, that are tired of those copays. Hey, I get a free chance to get a Medicare supplement, even though I'm 75 and I've got cancer and COPD. They are not offering that Medicare Advantage plan, and Medicare lets that person get a Medicare supplement, but not just any Medicare supplement. It used to be the Medicare Plan F that everybody would go into before January 1st of 2020. So those are the reasons why I don't like the Plan F. Now, you might be asking, well, what about after January 1st of 2020? My job is to find a Medicare supplement with the least amount of rate instability. So let's throw the Plan F. Let's segue into the Plan G. Now, the Plan G is the most comprehensive Medicare supplement for people turning 65. Because remember, they can't get the Plan F anymore. We're at 65 on January 1st of 2020. You can't get the F, and the most comprehensive plan is the Plan G. So let's take a look at the benefits. Looks pretty darn similar to the Plan F. Pays everything except, boom, right here, your Medicare Part B deductible. For 2022, the Medicare Part B deductible is $233. So, I mean, the Plan G is almost as comprehensive as the F. Once you pay the $233 deductible, it's a Part B deductible, doctor's visits, outpatient, blood work, things like that. Once you pay $233, guess what? You never have a bill the rest of the year. You go to get MD Anderson to get cancer treatment for 6 weeks, 3 months, whatever. You pay your $233 deductible. After that, pays all that cancer treatment, pays hospital stays. When you go to the specialist, you don't even have a copay. You go to the doctor, no copay. Anything is no copay. Once you hit the $233 deductible, the Plan G turns into the Plan F. But remember I was telling you about the Plan F, and before January 1st of 2020, they were the Medicare supplement plan that all those sick people that could leave their Advantage plans and go to a supplement went to, or they lost their retiree coverage, or they were on an Advantage plan when they turned 65, but 8 months later they found out they had COPD. They have 12 months to get into a Medicare supplement with no health questions asked. All right? So instead of the Plan F, it's the Plan G that has to accept those sick people. Okay, guys, before I bash the heck out of the Plan G, and look you in the eyes and tell you, if anybody's put you in the Plan G in the last 3 to 4 years, this agent's either lazy and just doesn't want to explain better options like the Plan N, or they realize the Plan G premiums are more expensive than the less costly Plan N, and they just throw you in there. But bottom line is this: the Plan G has always had more value than the Plan F. For years, I sold the Plan G back in 2015, 16, 17, because I'd explain to people, look, the Plan G and F are almost identical, other than the Plan G has that little Part B deductible, which this year is $233 annual deductible. Once you hit the $233, the Plan G pays everything. So basically what I told people years back was this: look, the Plan G is right around $600 less a year in premium than the Plan F. Only difference is that $233 Part B deductible that you have to pay with the G. But let's face it, you subtract the $233 deductible from $600, and you're right around $400 in savings. So people that have the Plan F, it's more of a convenience thing. They basically would pay $400 or $500 extra a year in premium, just so they could have first dollar coverage and never have a $233 deductible. But I'm telling you right now, if you're on the Plan F, you got big problems. If you're on the Plan G and you're healthy, you need to get off, all right? Because here's the thing. As of January 1st of 2020, the Plan G, not the Plan F, must absorb the high cost of accepting folks that use their guaranteed issue. Remember those little circumstances I told you about? People that lose their group coverage. Those sick people are now going to go to the Plan G because that's the only supplemental plan that they can go to. They can't go to the Plan N. The Plan F is no longer available. So the Plan G, the Plan G, not the Plan F, must sell a supplement to folks sick with pre-existing conditions. They can't charge higher premiums because of past or present health issues. So you've got a huge pool of people that loses their Advantage plan, it leaves the area, or let's say they move, or let's say they lose their group coverage, or they use their trial right when they first go on Medicare to leave the Advantage plan and go back on a supplement. All those cases, all of those are going to go to the Plan G. We're already seeing the Plan G rate starting to go up, up, up. It's going to get It's going to get ugly. Okay, guys. So in conclusion, this is what I'm saying. As a result of MACRA, the 2020 law, Plan G is now available to customers with 6 or 7 federal GI, guaranteed issue rights, for the first time. This is going to increase the portion of high-cost customers and place more and more pressure on insurers to raise premiums. In 2020, the pressure was low. There was only 1 year of newly eligible customers with federal guaranteed issue rights, but the pressure will increase each year as more and more people age into Medicare. This means Plan G premiums will increase faster than those of plans with fewer guaranteed rights, such as the Plan N. The Plan N doesn't take sick people. Plan N is not required by law to take people that lose their Advantage plans, their group coverage, use their trial right, or the other guaranteed issue rights that people use that are sick, okay? So we got to look at the 80-20 rule. The impact of these rights on premiums can be generalized by the 80-20 rule. A small increase in the number of high-cost sick customers in the plan can cause a huge increase in the premium charge to customers. All right? Now, So, in these situations, insurers must offer certain Medicare supplement plans, the Plan G. It's the most comprehensive plan. It's the most plan with most value for, there's a few other old plans they can choose from that they're outdated, they're dinosaurs. People are going to go straight to the Plan G. They can't go to the Plan N, which is almost identical to the Plan G, the Plan N. So, in these situations, certain Medicare supplement plans, the Plan G, without the ability to screen for high-cost chronic health conditions, they can't screen for it, medically underwrite. The portion of customers granted these rights is small, but the impact on the health plan is significant, all right? The other thing, too, is this. As of 2020, Plan G offers the most comprehensive coverage. So let's think about this. Before 2020, customers who preferred comprehensive coverage and no-cost sharing purchased Plan F. Most customers who preferred a lower premium and some out-of-pocket costs purchase the Plan G or the Plan N. So that all changed in 2020. Customers who sick people new to Medicare that want the most comprehensive coverage, they're going to go with the Plan G. Most customers who prefer a low premium and additional cost sharing prefer the Plan N. Typically, customers who anticipate frequent physician visits tend to gravitate towards the comprehensive Plan G. Customers who are relatively healthy and anticipate infrequent physician visits tend to gravitate to the lower premium Plan N. All right? And then it says, over time, this purchasing divide impacts the health care expenses paid by the underlying plan. Higher cost Plan G customers have higher premiums, and lower Plan N customers have lower premiums. The impact is gradual because the selection process based on health status between Plan G and Plan N is limited to newly eligible customers. Okay, guys, so we know the Plan F is not the way to go. Older, sicker group of people. It does pay everything Medicare doesn't. And if you were under 65 as of January 1st, 2020, you can't even get the Plan F. If you have the Plan F, call me. Older, sicker group of people. For years, they had to take the sick folks that used their guaranteed issue right. Now, we just talked about the Plan G. Because of the macro law in January 1st of 2020, the Plan G must absorb the high costs of a small pool of sick people that guarantee their guaranteed issue rights. So the Plan G, the only difference between the Plan G and the Plan F is that $233 Part B deductible. With the Plan N, you also have to pay that annual $233 deductible, but there's a little thing right here called excess charges. Now, excess charges are Medicare Part B excess charges. It's when a doctor that doesn't accept Medicare charges more than the Medicare approved fee schedule, and they can charge up to 15% above the Medicare fee schedule. So just as an example, you decided to go to a clinic that doesn't accept Medicare assignment. The doctor could impose a Medicare Part B excess charge of 15% on top of the $100 charge for the echocardiogram. So instead of $100, you're going to pay $115. Here's the thing, guys. In my 11 years of strictly and solely dealing with Medicare, being a Medicare advocate, I've never seen it. It's never come into play. That's because 96% of all doctors accept Medicare. And you know what? Here's an easy fix. If you're not sure if your doctor accepts Medicare, go to www.medicare.gov, this link right here. Type in your doctor's name. The Medicare will tell you whether or not he accepts assignment. But again, doesn't come into play. And we can take precautions necessary to make sure you don't go to a doctor that doesn't accept Medicare. Only other little thing is, like I said earlier, Plan N, when you go to a doctor, doesn't matter what kind of doctor it is, you're going to pay between $0 and $20 copay. That's good. You know why? Because healthy people turning 65, they like the lower premium. They don't care about a $0 to $20 copay. They go once or twice or 3 times a year. No big deal. And you have a $50 emergency room copay. That's the only difference. They're virtually the same coverage. The only difference is Plan N premiums are lower, but you're not on Medicare just for today. You're on Medicare the rest of your life. And that independent study I talked about earlier states it clearly. Insurance companies are calling me saying, you don't want to put your guys in the Plan G. Our rates are going to be going up 12, 13, 14% next year. So if you want to keep your clients, put them in the Plan N. There's 2 reasons why agents put you in the Plan G. One is just that they're ignorant. They have no clue what we're talking about here today. And the other reason is they know the Plan G is a higher premium and they get paid a higher commission. And guess what? If you get sick, you cannot go back. You can't change Medicare supplement plans. You're stuck for life. So would you rather be on a Medicare supplement if you get sick that's got very low projected rate increases? Or would you rather be on Medicare Supplement Plan G, this force accept sick people that use their guaranteed right issue? You know, the choice is yours. But again, I'm looking out for you, not just today, but I'm looking out for you for the next 10, 20 years. I'm looking at your future rate increases. That's the number one danger to getting a Medicare supplement. So, you know, I've got people that come in and tell me, I just want the Plan G because my neighbor has it and they said it was good. Well, you know what? I've actually said, all right, well, good luck. Go do business with your other agent, because I just, you're coming to me for help and for expertise and for years of experience. So when it comes to Medicare, there's two things I do really well. I'm great at Medicare, pretty good at basketball too. I still beat my 17-year-old son. He's never beat me yet. So I'm pretty good at that, pretty good at Medicare. Those two things I'm going to stick to and do well at. So anyway, this is Chris Dewey with May River Medicare. I hope you enjoyed the Medicare Advantage versus Medicare supplement and which supplement to pick. You guys have a great day. Bye-bye.